Welcome to Live with the Eczema Doc, brought to you by Cleanbody, where we believe that you can heal your skin from within by cleaning your body. I'm Dr. Fong, a naturopathic doctor specializing in eczema, and I'm here to guide you through the journey of understanding the root causes of your eczema so that you can finally achieve the clear, healthy skin you deserve. Each week, we combine research-backed insights, science-based strategies, and my years of clinical experience to uncover what's really triggering your eczema and how you can take control for lasting relief. Let's dive into today's episode and uncover the next step to healing your skin from within. Today, I am talking about the 7 types of eczema. And sometimes we talk about eczema and we don't realize that there are different types of eczema. So I'd like to break down those different types of eczema today. And I would also like to help you to understand if you have these types of eczema, what are the root causes of each of these types of eczema? Each of these types of eczema may have a different root cause. And so we need to talk about them individually. I think often we kind of just treat eczema as one type of disease. There are different types, there are different causes. And so I would really like to go into that today so that we can understand, what those different types are and how it might be different in terms of tackling each of those different types of eczema. So if you have eczema, definitely tune into this because we want to understand how are we going to address these different types. That's really what we're here for, right? If you're suffering from eczema, we want to know, okay, how do we fix this problem? So we're going to dive into this today. So the first one is the one we talk about the most, and this is called atopic dermatitis. This is a type of eczema that often starts in childhood. It can be linked to mutations in our genetics, specifically a gene called filaggrin. So sometimes we see this in childhood in our babies. Sometimes it is because there is a genetic component to the eczema, and especially this is true in atopic dermatitis. We might see that the skin is very dry, and there could also be a lot of infections, specifically staph infections that might come up where your child may end up needing antibiotics because there's just staph infections over and over and over again, okay? And sometimes that is because of that filaggrin mutation that may cause what I like to call leaky skin, where the barrier of the skin is not very strong. And then when that barrier is compromised from a genetic point of view, then the skin is more open to getting infections, okay? So how do we address this? Because when we think about, okay, first of all, this might actually be due to leaky skin. Well, sometimes this can be also related to our gut, and we might have leaky gut. So what is leaky gut? Well, leaky gut is one same thing. The lining of your gut may actually be leaky, and you may actually be able to leak proteins through your gut lining that you aren't supposed to be leaking into your system. This may cause inflammation and this cascade of things that happens that will increase inflammation and therefore cause eczema in the system. So, what do we do at Cleanbody? Well, we always start with healing the gut, making sure that you have a good barrier for your skin, making sure that you are not irritating that skin barrier or that gut barrier by eating foods that might cause inflammation, by exposing yourself to toxins orally, by also exposing yourself to toxins topically as well too. So making sure that the products you're using are really great, that you are really lowering those exposures in terms of toxins that you are putting on your skin. And so that could be things like parabens, that could be, synthetic cosmetics that you're putting on your skin. It could be chemicals and fragrances. And so we want to go as clean as possible for those topicals, okay? And so then we also need to make sure, because we are thinking about that gut lining, that you are eating clean food, and we are then strengthening the barrier of the gut, and we are strengthening the barrier of the skin from within by providing the skin with a lot of the nutrients we need, like the lipids or the good fats like omega-3s that help the skin to really have that strong barrier. That's one of the most important, I would say, is omega-3s, okay? So my pro tips would be to use a very good skin protectant if atopic dermatitis is the main problem. And this can be different for different types of eczema, okay? But in this type of eczema, especially when it starts in childhood, we do want to use oil based moisturizers potentially, ointments, and things that are very kind of thick and allow that barrier to be really protected. Even things like ceramides could be good. At Cleanbody, we have a product called Clean Skin Protect, and that's a really great protectant for the skin. It is coconut free and gluten free and dairy free. And so I also noticed that when you are choosing these ointments, you do want to make sure that you're choosing ointments with ingredients that don't irritate your skin. So, unfortunately, some of my patients have problems with coconut oil. So, that's why I formulated Clean Skin Protect to be free of coconut oil. You could also do things like use a humidifier. So, when that barrier is very leaky, you might notice that the skin does not hold on to moisture very well. And so, having a humidifier or in the home can be very helpful. And, putting the humidity around 55 to 60, we also don't want it to get too humid because this can also lead to potentially mold growing in our homes. So there's a happy balance here. And I do feel that between 55 and 60 is usually a good humidity. So if you have a lot of dry skin, if your child or you have atopic dermatitis, really think about that humidity in the home. And then at Clean Body, it's not just about putting good food into your system, but we now have to heal that gut lining as well. And so we use what I like to call a 4R gut healing protocol. And this is where we have to employ the 4R. So the first R is rid. We got to rid the system of any foods that are causing inflammation, maybe pathogens that are affecting the gut lining and affecting the inflammation and the gut health and the microbiome health. Number two, we have to replace. So, any problems that the gut is having, maybe the gut is not producing enough digestive enzymes, maybe you're not producing enough bile, maybe you don't have enough bile acids to create that bile. We will need to provide those while we are healing you. The goal is not to keep you on these forever, but to do that while we are healing this gut lining. And then we have, after that, repair. So now we can use foods, but we can also use supplements to repair the gut lining. Some of my favorites in this department include herbs like slippery elm and DGL, amino acids like L-glutamine. I do also really love a peptide therapy as an option here, and just good food as well. By avoiding foods that are inflammatory or foods that you're sensitive or allergic to, you'll really give the gut a chance to heal. Okay. We also might look at immunoglobulins that can really help clean up the microbiome and then also promote that leaky gut to heal as well. There are ways we can test for that leaky gut so that we could see how much we have to repair the gut lining. And then we can employ methods and then retest and check to make sure that that leaky gut has gotten better. And finally, the last R is restore. And this is where we might then give probiotics that are missing. And we have done some testing so we can figure out what probiotics we need to give. And often, when we think about treating eczema naturally, I think the first thing we think of is, okay, let's just give probiotics. And it's interesting how that's the fourth R. So we actually have to do the first three R's before we can actually do the fourth R and have that fourth R be successful. So that would really be our goal. Okay. So that 4R gut healing protocol for atopic dermatitis works really beautifully. And if you have atopic dermatitis, these things might help you if you just start thinking about employing some of these. And then, of course, working with a practitioner like myself and my team, because we can do some testing, we can also really pinpoint the things that we might need to do for you in order to heal the things that we have found that are imbalanced. Okay. Next on my list is contact dermatitis. And this is where you might wear something like a watch, maybe a necklace, maybe some earrings, or maybe even your belt buckle. And then you notice that you get dermatitis from wherever you wearing that item. Or maybe you have put something like a lotion or something onto your skin and you just keep getting itchy and you're really not sure what's going on, but it is every time you put that lotion on. Well, this is contact dermatitis. It typically does not run in families, or it's not linked to other conditions like asthma. It may not have that genetic component. It is common among people who use chemicals very frequently. This may actually stem from an issue of being overly toxic. Sometimes this actually doesn't have to do with our genetics, but more our environment, that we are just exposing ourselves to so many toxins. Now, these toxins can be oral. It could be the food you're eating. Maybe you're drinking a lot of alcohol. Maybe you're eating a lot of GMO foods. Maybe you're just eating fast food or gas station food all the time. I had a patient who was basically, his whole diet was gas station food and fast food. And all we did to start off with was, hey, let's stop eating those foods. Let's have your wife cook some, home cooked meals. And the eczema is completely better. So for some people, it's this toxic burden. Food is a big place that you want to look, but also now your exposure. So there are people who work in the oil industry or work in salons. That has been a big one for me too, where you're exposed to all these chemicals all day long and you're expecting the body to just be okay with these exposures, but there will be a limit. And I like to say that we have a funnel and that funnel can overflow. And everybody has a different limit, right? So you have to figure out what yours is. If you are getting contact dermatitis, it is possible that your funnel is overflowing. So, what we want to do here is we want to identify the toxic exposures. We can do that by listening to your story. What is going on in your life? What exposures do you have? And then, of course, testing. We could test for toxins. We could run tests for environmental toxins, heavy metal toxins, mold toxins, food toxins, and we can kind of identify what your body's having the most burden with. Then we can also test to see how much burden is your body actually having. And then we can provide support by one, eliminating those exposures, two, supporting the drainage systems. Now, that is your liver, your kidney, your gut. These are the organs in your body that eliminate these toxins. And then finally, we might actually need to do some cleansing. Now, that could be chelation, where we're actually binding up things like heavy metals, pulling them out of the body, and then they get out and they exit, hopefully. Also, that could be other cleansing protocols where we're just helping those toxins to get out. We may use sweating, IR sauna. We could use supplements and herbs. We could use homeopathy. There's so many ways to do this. And if this is a child, we do need to make sure we are going very slow and very gentle. But even if it's not a child, an adult can actually need to go very slow here too. So you might hear this and then all of a sudden you're like, oh my gosh, I need to cleanse. I need to cleanse right now. And that will heal my eczema. But sometimes that's not where we need to start. We actually need to help those drainage systems open up first and allow the body to heal a little bit before we actually cleanse. So that's where I see some people going wrong here, is that they identify, okay, I'm very toxic, but the problem is that instead of kind of taking the steps they need to clean up, they go straight to cleansing, and then now all of their symptoms get exacerbated because the system cannot handle that load of toxins coming out all at once. Okay, it's like you have this stuck funnel and there's kind of like a backup there. And then you're now trying to push all those toxins out and the body can't handle it. So you'll want to make sure if you have contact dermatitis, so stop those exposures if you can. If you can identify what those exposures are, those toxic exposures, try to stop those exposures if you can. In all of your products that you use, everything from your shampoo to your lotions to your laundry detergent, make sure they're all clean. So you can go to my product recommendations. The link in my bio has the product recommendations, or you can go to cleanbody.health/products and you can see all of my product recommendations that are clean. I also love EWG as a resource, so ewg.org. They have a resource for cosmetics and baby products and laundry detergent. And if you have a baby, this is especially important that you start using clean products now. Then you want to make sure when you try anything new, just make sure you patch test anything because you have contact dermatitis. For the most part, for people with contact dermatitis, almost everything they put on their skin might cause a reaction. So just check it first. And I will tell you that I had atopic dermatitis and I also had contact dermatitis. And sometimes we can have a couple of these types of eczema. So I had both, and I was so sensitive to any products that were on my skin before. Nowadays, I am not sensitive. So I used to not be able to go to a hotel and use the hotel products, and I can do that now. Now, I don't necessarily choose to do that just because some of the times those products are toxic, but I don't have any problems with that. I also used to walk through the department stores, and get exposed to all the perfumes, and I used to get itchy from that. And that no longer happens to me because my funnel is so clean. The other thing is, you can start taking some liver support. I do recommend that you work with a practitioner to figure out the best liver support for you. At Cleanbody, we do have a couple nice options though that are available for purchase. So Bile Essentials is really great. We have Cleanbody Cleanse if you prefer to do a nice detox smoothie in the morning. We also have the Clean Liver formula. These are really nice options that you can just kind of use for gentle liver support. But often, if you do truly have contact dermatitis, it's not enough to just take out the exposures. It's not enough to just take a little bit of liver support. You sometimes actually need to do a very thorough cleanse. So, that's something a practitioner can help you with. Number 3 on our list is dyshidrotic eczema. This type of eczema is mostly you can see it on the hands and feet, and you will see that there are little bubbles. So they almost look like little vesicles on your hands or your feet. And usually it's only in these areas. You don't typically have the eczema in other places. And again, sometimes people can have the dyshidrotic eczema and other types of eczema as well too. But mostly this is on the hands, the palms and soles and edges of the fingers and toes, and they're these little blisters. This is common to run in families. It is more common in women. And I will say that when I have seen this with patients, I have seen that a big trigger is stress. And one of the greatest stories I have about this is I had someone with dyshidrotic eczema. We cleaned up everything from her diet to her environment, especially the stress piece. And then everything was clear and within 3 or 4 months. And then she comes back, a couple months later, maybe 6 months later, and she's like, Dr. Fong, it came back. And I said, okay, what changed? And what had changed was her stress increased significantly, but nothing else changed. Her diet didn't change, her exposures didn't change. So that, was one story and the first story that really showed me that stress plays a big role in dyshidrotic eczema particularly. And then, I've had now multiple stories that have proved that again and again. So if you do have this type of eczema, I would really look at stress as, where are you stressed? Are you stressed and you don't even know it is one thing to think about because sometimes we just don't even know we're stressed. Another one that I see is an allergy or a toxicity to nickel. And primarily one of the places you might see this is your exposures to stainless steel. So stainless steel is even in our forks and our spoons. So you may want to change those out to nickel-free options. When you're looking for stainless steel, you can look for the type of stainless steel that's labeled 18/0. That 0 means that there is no other metals in there. It's really just stainless steel. The problem with these 18/0 forks and spoons, for example, is they just might not last as long, but it's going to be well worth it if you're someone who deals with something like dyshidrotic eczema. If you have a lot of seasonal allergies, if you get these when it's more humid, that is sometimes a trigger as well too. Often people who are having jobs where they have to wash their hands frequently, like doctors or nurses, or people who are working in a salon, constantly have to wash their hands. And sometimes that process can also cause a dyshidrotic eczema. So you want to think there about the soaps that you're using. Are they harsh? Can you use more gentle soaps? So, how do we attack this at Cleanbody? Well, we want to assess your stress. We call this clean mind at Cleanbody. We want to know how clean your mind is. Are you super stressed? Are you always in fight or flight mode? We want to support your immune system, and we want to make sure that you're doing all the things you need to do for your clean routine, staying hydrated, reducing things like caffeine, reducing maybe your exposure to nickel. We can also test for nickel toxicity. That's something we can check for. And then that kind of confirms, okay, you need to go completely nickel free. I do want you, if you do have dyshidrotic eczema, really try to assess if stress is a problem. And again, it can be hard to identify this. If you do identify, okay, I am stressed, I do need to figure out how to work through this, I recommend working with someone through therapy. We do something at Cleanbody called the Clean Mind Sessions, where I help you to do some meditations so you can identify your traumas and process and work through them. You can also work with, meditation. You can work with yoga. You can work with a therapist to figure out tools for yourself so that you can lower your stress and identify your triggers and work through some of your traumas and emotions that you're experiencing. It is not bad for you to have emotions. you need to learn how to respond to those in a different way. One of my favorites is the 4-7-8 breath. So you breathe in through your nose for 4 counts, you hold the breath for 7 counts, and you release for 8 counts nice and slow. As you're doing that, you release that breath out your mouth, and your belly is kind of rising and falling as you're doing this breath. So, you just need tools to get yourself out of that fight or flight mode. Okay. So, definitely, if you have dyshidrotic eczema, assess for stress. Next on our list is nummular eczema. This is where the eczema looks like little circles on the skin. And these they're about coin shaped. So they're coin size. They're scattered around the body and they can be itchy, they can be oozing. This is more commonly seen in males. And we will see that when the skin is very dry, or maybe there's some kind of exposure like an insect bite or some kind of trauma to the skin, that you may then get these scattered coin shaped patches. So we want to make sure that you're very hydrated because dry skin can kind of lead to more of this type of eczema. So you want to focus on rehydrating the body both internally and externally. And with this one, you can be using things like lipid-based moisturizers like Clean Skin Protect. You want to focus on whether there are any sensitivities and allergies nutritionally in your diet, and then also topically as well, just so that you aren't, causing any problems to the skin barrier. And then protect yourself from insect bites and any trauma to the skin. And using the fragrance free products, hypoallergenic products, is important for all types of eczema. But, with nummular eczema, you want to focus on that too. Next on our list is seborrheic dermatitis. And sometimes people don't realize that seborrheic dermatitis is a form of eczema. And it looks like dandruff, rashes, itching. Primarily, you'll see this on the scalp as dandruff, but you'll also see this in other areas like your eyebrows, maybe around your nose, on your neck, even sometimes. And primarily, it's where you're going to see a lot of oil buildup. And that is because the problem here is an overgrowth of a type of yeast called Malassezia. And Malassezia loves to feed on oil. So you're going to see this in those oil rich areas, the areas where you're going to have a lot of those oil producing glands, like the upper back and the nose, even. So, even on this back area. And, I do often see this happening sometimes in people who don't shampoo their hair a lot. So, there's kind of a balance here. And usually I assess the patient, and sometimes I'll hear that the patient's only shampooing their hair once a week. And that can lead to more oil on the scalp, and therefore the Malassezia loves to feed on this. Now, Malassezia is a yeast that our bodies can have. It can be commensal to our bodies. And it just depends on how much oil we have, in terms of how much yeast might grow there. So if you are only shampooing your hair only once a week, you may want to think of bumping that up a little bit. And depending on, of course, if that now dries out your hair, also thinking about what shampoo you're using. I do like probiotic shampoos. I like shampoos that are natural but geared towards seborrheic dermatitis that will, kind of be low in those oils and maybe higher in ingredients that will address the yeast. Yes, this is a yeast growing on your skin, but this can be related to the microbiome and the health of the microbiome inside the gut. So you need to make sure that you are focusing on the microbiome in the gut as well. And doing some testing for the gut microbiome can be very, very helpful. So you can understand, okay, what is the balance of the gut microbiome? What does my yeast look like? What does my bacteria look like? And then we do need to adjust the diet as well. So yes, we want to address this externally. Most of the things out there that you'll see are, okay, use these products. This is for Malassezia, or use this seborrheic dermatitis shampoo. It is not addressing the root cause, which actually might be an imbalance in your gut. And you might actually be eating a lot of sugar, a lot of carbs, a lot of processed foods, and yeast loves to thrive on these. And so often I will see that my patients with seborrheic dermatitis will get higher levels of seborrheic dermatitis when they're eating so much sugar. So assess your diet and see how much sugar you're eating. That would be the first place to start. But taking out sugar is not the only thing. Taking out sugar, again, we have to do that 4-hour gut healing program, just like I talked about for atopic dermatitis. And that 4-hour gut healing program, the first R is RID, but we still have to do the rest of those R's. And RID for this one is really sugar, is a really big, big, big one. Okay. When you're thinking about topicals, you want to avoid oil-based moisturizers because Malassezia feeds on oil. So we want to make sure not to use oil-based moisturizers. Our product at Cleanbody is called Clean Restore. That's a probiotic that's a topical that can help to maybe support the microbiome of the skin. And then antifungal remedies might be helpful, like tea tree oil, grapefruit seed extract, etc. You might also see in over the counter topicals for seborrheic dermatitis. But again, these are not going to be what necessarily heals that seborrheic dermatitis. We have to go inside of the body. Take away those sugars. Alcohol is a big one too, okay? Next one on our list is called stasis dermatitis. Now, for this one, this might be when someone has really poor circulation and then they get this swelling, itching, and skin irritation just because we're seeing the swelling happen and there isn't this circulation that's happening that's cleaning everything up. And it's often associated with aging, heart or kidney disease, if you have varicose veins, high blood pressure. If you have had multiple pregnancies, we might see this happen more often. And if you're someone who just sits or stands a lot and just you see this swelling of your legs, and we'll often see this on the feet or the legs, then you just have to get up. You have to move around. You might have to put your legs up and elevate them for at least 15 minutes a day, if not longer. And our Cleanbody solution here is we got to address, first of all, what is causing that venous insufficiency, if it's a heart or kidney disease, etc. If it's just aging, we need to make sure that you are moving around, you're getting that circulation pumping, and we want to do a little bit of exercise because exercise gets that blood pumping. We also can focus on foods that improve circulation, like cayenne pepper and turmeric, and we need to strengthen that vein health. We can do that with supplements, but of course, exercise can also strengthen that vein health. So elevate your legs again for 15 minutes a day. We want to focus on lymphatic drainage massage or exercise, which also does that. I love rebounding as well. That will, rebounding, which is jumping up and down on a trampoline, is great for kind of moving that circulation as well. And then you can also wear compression socks to help with this. Lastly, we have neurodermatitis. All right, so neurodermatitis is a super intense itching and it leads to constant scratching in typically a certain place in the body. Typically, it's confined to one or two areas of the body, and we often see this in the hands, the neck, or the scalp area. And then you'll see because you're really abusing that area, you see a thick, leathery patch on the skin, and we call that lichenification. And these scratching activities basically it activates your brain's reward center. And so we see this as more of a nervous system potentially issue. And sometimes this happens because of stress. And it's something that your body just is very used to, and you're just kind of scratching in that area and you're actually doing it as a stress response. And so tune in again. Tune into your emotions, your feelings, your thoughts. Sit with yourself, again, work on therapy, talk to somebody. But sometimes when you are itchy, what I invite you to do is actually close your eyes. And when you're in that super itchy place, instead of itching, what you can do is maybe hold that area instead of itching it. Breathe and try to evaluate, am I having an emotions right now? And if you are, first start by identifying what that emotion is. And then working through, okay, why am I having that emotion? How can I clear that? How can I process it? How can I allow that emotion to just kind of float away? And it's not bad to have the emotions. We are going to have emotions, but we do need to work on how we respond to them, okay? Other things that can help, of course, anything else related to stress. So improving your sleep hygiene, reducing stimulants that are maybe going to affect your stress process, like caffeine, can be really helpful. In the meantime, while you're working on all this, you might want to cover the area. I do like bandages like the Visco paste bandage, or even just wearing gloves that are clean glove that's not going to cause more irritation. And we can do things like taking calming herbs and adaptogenic herbs. We can work on the 4-7-8 breaths. So, stress, I would say, would be a big one here for neurodermatitis. Okay, so if you're noticing that it's in one or two places and you are actually noticing that it's mostly when you're stressed, we really want to think about this, okay? So those are the 7 types of eczema, and I hope this has helped you first off identify maybe what type of eczema you're having. Also, how do you tackle that type of eczema? And as you can see, a lot of these ways we tackle might actually be similar for a lot of these types of eczema. But for some of them, there are very specific things that you can do to make sure that you are addressing the root cause of that specific type of eczema. Now, it can be hard to, first of all, identify what type of eczema you're having. And then, second of all, how do you address this? So, I definitely recommend working with a knowledgeable practitioner to try to figure out, first of all, what kind of eczema you're having, then how to tackle it. I will say that in conventional medicine, we often tackle all of these in the same way. We just give you anti inflammatories, we give you topicals, injections that just lower the inflammatory and immune response. And to me, that is not an answer. That is not a lasting answer because, as you can see, there are different reasons why we have all these different types of eczema. So we need to tackle them differently. We need to understand what your problems are, what your microbiome looks like, what pathogens you have, etc., to really, really get to the root cause. So I invite you to really delve into this. You can start by actually taking my root cause assessment, and that is in the link in my bio, in the link in the podcast description here. And that will help you to first off identify, okay, where am I maybe missing a piece? What are the root causes of my eczema? And then, what can I maybe do to address those? And then working with a practitioner or a team can be really, really helpful because now you're not just kind of guessing what do I need to be doing? You're really targeting and honing in on what you need to do. Okay. So, being an eczema survivor myself, I know how difficult this journey can be. I hope that this episode really helps you to just start the process of identifying what you might need to do. And then I truly hope that you take those reins and you address those root causes and you find the relief that you're looking for. Thank you for joining live with the Eczema Doc. I hope today's episode provided you with valuable insights and tools to support your journey to healing your skin from within. For more information, visit www.cleanbody.health or check the links in the podcast description. You'll find the studies and resources discussed today on my blog. You can also take my free eczema root cause assessment to uncover potential triggers or download my free eczema relief guide for quick, practical tips to calm flare-ups and help with your sleep. If you found this episode helpful, please remember to like, subscribe, and share the podcast to help others on their healing journey. And if you'd like to stay updated with future episodes, please turn on your notifications so you don't miss a thing. Please remember this podcast is for informational purposes only and does not constitute medical advice. Always consult with your healthcare provider or book a consultation with me before making any changes to your healthcare regimen. When you clean your body, you heal your skin from within. Thank you again for listening, and I'll see you next week.